So my point is that the first 5 intercostal nerves are called intercostal nerves, but the rest from 6 to 12 are called the thoracoabdominal nerves, because yes, they originate within the ribs, within the intercostal nerves, that's part of the thoracic cage, thoraco, but when they emerge, when their cutaneous branches emerge, they find themselves within the abdominal region, so therefore thoracoabdominal nerves. Okay, so that means that when you look at this anterior cutaneous branch here, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, this is not, don't think of this anterior cutaneous branch being actually part of the, I don't know, the lumbar nerves or something. No, these are still, this is the anterior cutaneous branch of the 10th intercostal nerve, so it's still part of the thorax, although it's emerging all the way down here in the abdomen close to the umbilicus. It's still part of the intercostal nerve, and therefore it's part of the thoracic cage, but because it emerges in the abdomen, it's called the thoracoabdominal nerve. This thoracoabdominal nerve is also found between the innermost layer, in this case transversus abdominis, and the middle layer, which is the internal oblique. Okay, just like the intercostal nerve in the thoracic region was between the innermost intercostal and internal intercostal, here it's also in the abdominal region, it's also between the innermost and middle layer. So this thoracoabdominal nerve will stay within this area between the innermost and middle layer, and because so it has to go all the way here, but because there is this membrane from the internal oblique, it will therefore have to puncture through it and continue as far to the midline as possible, just like in intercostal nerves. They also did the exact same thing. They went all the way along the forward, and they went all the way anteriorly, and then once they're all the way near the midline, they will give off an anterior cutaneous branch, which in this case was going to puncture through the rectus abdominis muscle and then through the anterior rectus sheath. So this anterior cutaneous branch of this thoracoabdominal nerve is going to supply innervation to the rectus abdominis as well as to the skin of the front of the body. So I hope you understand that. So see, here is the same thing. This is the thoracic region. There's the intercostal nerve going all the way anterior to the sternum, to the midline, giving a lateral cutaneous branch here and an anterior cutaneous branch here. And this anterior cutaneous branch is going to innervate the skin here. And this is the cut here. If you cut it at the abdominal region, we have exact same thing. We have the 3 layers, in this case internal, but in this case it's transversus abdominis, internal oblique, external oblique, and it's also going between the innermost and middle, just like here, between the innermost and middle layer. Okay, but when it gives off an anterior cutaneous branch here, just exact same thing as this. Here it is. It's going to puncture the rectus abdominis muscle and then the anterior rectus sheath. Whereas in here, there is no rectus abdominis muscle in the chest, so it just punctures the internal oblique, and then the external oblique, the internal intercostal and external intercostal membrane, and then it protrudes out.